Can we do it better?
Greetings everyone, welcome to yet another episode of the NMS Health Talks. In the studio, here I am Esther Bamponda, your host. I'll be hosting none other than Sam Humza. In that regard, you will introduce yourself and tell us what you do in NMS and how long you have been in NMS.
Okay, thank you so much. Just like the host has introduced me, my name is Samuel Muhumza. I'm the Transport and Logistics Officer here at National Medical Stores, attached to the Stores and Operations Department, as well as the Transport function under the same department. I've been in National Medical Stores since 2019, so I guess this year those are averagely 6 to 7 years. What I do, I basically in charge of driver management, so things to do with driver deployment, overseeing the fleet. There's quite a lot, so that's pretty much it. Thank you so much.
You're most welcome. We've been having these health talks for the past 1.5 years. We started health talks for the past, it started last year, but one and a half years. We've been here with health talks. We talk about different subjects related, health related, to be specific. And as National Medical Stores, we are a government entity mandated to procure, store, and distribute essential medicines and health supplies to all government health facilities. And one may ask, what is the difference between NMS and GMS? GMS is a private organization. National Medical Stores is a government organization. So today we are going to talk about DMT and why we invited you here, Sam. We are going to talk about the DMT in National Medical Stores. To be specific, what is DMT?
Okay, thank you so much. So just a quick recap. National Medical Stores basically will ensure that all Ugandan public health facilities receive essential medicines and health supplies they need on time and in full. So we today basically here to talk about the DMT, as you have said. For those that don't know what the DMT is, this is a delivery monitoring tool. This is a digital tool that National Medical Stores uses to track its dispatches, its deliveries, keep in touch with stakeholders through the different alerts that are sent to them, as well as basically helps in strengthening the national medical supply chain. So when we're talking about the different stakeholders that get these alerts, I think we also need to talk about the different stakeholders of National Medical Stores. So I would be more interested in the external stakeholders. We have people like, we have the Ministry of Health, we have the local governments, we have National Drug Authority. Then among our developing partners, we have partners like Gavi, we have Global Fund, we have the World Health Organization. Then obviously we can't forget the public, the different health workers. I think those among others. Then obviously us, the internal stakeholders, us the staff that are also pushing the mandate, which is very, very important. So just like I've talked about, through the delivery monitoring tool, NMS tracks dispatches as well as deliveries. So upon making dispatches of the different natures of supplies that National Medical Stores delivers, different stakeholders get some of these alerts. And among the different stakeholders that get these alerts include the RDCs at the different districts, the LC5s, the chief administrative officers, the district health officers at the different districts. So it is very important to know that National Medical Stores delivers a range of nature of supplies, which include essential medicines and health supplies. We have surge deliveries. We have LPG and oxygen. We do vaccines as well. So all those natures of supplies are dispatched and delivered through the delivery monitoring tool. which is something we're here to talk about. Thank you so much.
Someone would wonder, how long has this DMT been in NMS? How long have you used DMT as NMS?
I believe the DMT has been here longer than I have, because I came through in 2019, and prior to that, I found it here as well. So I'm pretty sure it has been around, I think, for the last 10 to 8 years, and it has helped tremendously in the medical supply chain, basically. Yeah.
So what does how does that DMT operate actually?
Okay. So I think an in-depth explanation will be given during the demonstration, but just to give an overview, basically, just like I've said, the delivery monitoring tool is a digital platform that National Medical Store uses to track the dispatches, the deliveries, and keep in touch with the different stakeholders through different alerts, as well as strengthen basically the national medical supply chain. Yeah? So when consignments, let me just give the background of the internal processes, a brief background. So when we do the picking and the packing, after we've gotten the orders from the customers, to client services, to the stores and operations department, to the transport section, eventually the different orders translate into actual medicines, physical medicines. So after we've done all the internal processes of the paperwork and everything, so that's when our delivery team is in position to interface with delivery monitoring tool, the DMT. So these different deliveries are attached to specific trips. Just as you know, National Medical Stores delivers to all the 138 districts in the country, and all the different government health centers in the country. So you find all those are attached to different trips. So a trip is attached to a driver, a district, and a truck. So obviously, prior to exiting, the driver ought to log the dispatch on DMT. So after
Before you continue, in your submission, DMT does work only at the dispatch, or it also captures the order processes? Does it capture the order processes, or it starts from the dispatch to the tracking of the last mile?
Or just like the name is delivery monitoring tool, it's basically for delivery, for dispatch and deliveries. Whether it's delivery to the district, delivery to the lower facilities, basically starts from the point of the vehicle exiting to the person at the lower facility receiving the medicine. Exactly. So upon the driver logging onto the DMT, just like I was showing in the demonstration, the trip is in position to be dispatched. So let me just give an example. Let's assume a driver is called Anthony Mumali. He drives a Renault truck UBK 272E. Let's assume he's going to Kanungu DHO. So after we've done all the internal processes, we've given him the paperwork and everything, we have loaded the vehicle is set to go. Mumali will log on to DMT and look for the trip attached to him. The trip will bring the district, the cycle, the destination, number of cartons, everything. We shall even talk about the importance of DMT later on. Basically, it's for visibility purposes. Because the assumption is, if we have given Mumali 400 cartons for Kanungu DHO, ideally Mumali should deliver 400 cartons to Kanungu, and those 400 cartons should be able to reach the different people in the lower health centers. So all that.
Actually, now that you mentioned about the functionality, what are the functions of that DMT tool?
Okay. So among the functions of DMT, just like I'm explaining, it helps create visibility. Very, very important. It's very important for the people that are waiting for these medicines to be able to track them in real time. So just like I'm explaining, when the driver dispatches here, the alerts go to the different stakeholders, internal and external. So just like I talked about, the LC5s, the RDCs, the DHOs, the CAOs, those are among the people that receive these alerts, and based on that, information can even be spread to other people. So the public itself can also be able to access this information through the DMT portal. That's dmt.nms.go.ug. You go to the dispatched tab. That way you can be able to see what NMS has dispatched and what NMS has delivered, because there are different logs. There's dispatch from NMS, there's delivered to the health center, then there's also last mile delivery. Last mile delivery, that is to the lower public health facilities. As you're aware, National Medical Stores delivers to different levels of care, and among them we have national referrers, the Mulagos, Kawempe, Chirudu, a couple of them. Then we have the regional referrers as well in the different regions. That include Fort Portal Regional Referral, Movende, Gulu, Arua, Jinja, and others. Then we have the general hospitals as well. Then we have the health center 4s, the health center 2s. and 3s. Exactly. So on the DMT, someone can be positioned to, even someone from the public, you don't need logins to actually access some of this information.
Actually, you now that you mentioned, I was almost asking you, does everyone access DMT tool? Can anyone access
Yes,
DMT tool?
exactly. Everybody can, as long as you log on to, as long as you put in that DMT portal, dmt.nms.ug, you can be able to access all this information. The different tabs are there: dispatch from NMS, delivered by NMS, then also LMD itself, to all those lower health centers, 2s, 3s, as well as the 4s. Someone from the public can be able to access this information without necessarily having credentials. That way, someone can be able to, it helps create visibility. Someone knows that I've dispatched Kanungu DHO on today. The assumption is, considering the distance and everything, all factors kept constant. Today is Tuesday. If we dispatch Kanungu today in the morning, ideally by Wednesday mid-morning, the vehicle will be there delivering the medicines ready at the health facility. So through the DMT, it helps basically the general public to be well versed with the activities, so that by the time NMS is delivering at the facility, someone is very well aware, rather than not being in the know about what is actually happening, and someone remains wherever they are at without medicines, and that could actually compromise their health as well. Then among the other things that I believe, which is among the importances of the DMT, it helps create transparency and trust. So just like I've said, if someone from the public can be able to log onto the DMT and see, oh, okay, this district has been dispatched, it helps to show that there's some level of visibility in the supply chain. Just like I've talked about the lead times, if we have dispatched a vehicle today to a specific destination, considering the distance and everything, someone can be able to anticipate medicine within the shortest period of time. Yeah. Then, okay, to access the delivery monitoring tool website, you need to use your browser. Go to your browser and type in dmt.nms.go.ug. It will bring you to this. So this interface basically shows you the different tabs. So just like I talked about initially, this tab of dispatch from NMS basically shows what has been dispatched by NMS. So there are different filters here, and you can be able to find out, let's assume you want to track a dispatch from the previous financial year of 2024-25, you can filter that out. The different nature of supplies, if you're interested in finding out if National Medical Stores has dispatched oxygen to your place, you can be positioned to go on this drop down of nature of supplies and being positioned to filter that out. Then the districts, because considering the fact that this interface is basically showing real-time dispatches, it's comprised of very many dispatches. So let's assume you want to find out the dispatch to Kabarole. You can be positioned to type in Kabarole, then you go to go. So when you put that in, it's positioned to show you the last dispatches to Kabarole. So an example is this one here. It was for vaccines. It was done on 10th October. Then prior to that, we dispatched essential medicines to Kabarole on 28th August. Then so let's assume you want to find out delivery of essential medicines to Kabarole. So you filter out essential medicines. Then you search that. So it is important to filter for you all the last essential medicines dispatches to Kabarole. So basically, you can have a look here. We have the date, trip number, the cycle. We're in the financial. We have 12 cycles. It's showing here the vehicle number, vehicle make, the driver name. Just like I talked about, accountability is very, very important. Then, so that's basically the dispatch tab. Then we go to NMS deliveries. So just like I talked about initially, dispatch from NMS means from NMS, the truck and the delivery team have been dispatched there. So when we go to NMS deliveries, that shows the NMS team has been positioned to verify the consignment and has handed it over to the respective people, whether they are the nurses or the stores people. So that's when we come to the NMS deliveries tab. So just like I talked about, it has the same filters, facility, nature of supplies, the zone. We have 4 zones that we operate, so that we deliver to. We have 6 cycles. So the same applies to this. Let's assume we want to find out a delivery to Kanungu, so we're in position to put that in. So we filter out. Let's assume we want to find out when Kanungu received essential medicines. Let's just assume it's vaccines. We're in position to filter that out, and Just give me a minute. Essential medicines, Kanungu. We're in position to find out that we delivered to Kanungu on in that was June. Let's just give an example of another district. Let's do Kanungu. It's going to bring 2. Yeah, there's a drop down here. Let's assume it's vaccines to Kanungu. It will show that we last delivered vaccines on 11th October. That was, I think, barely 3-4 days ago. So that way you can motion to track the deliveries that NMS is making. So even if you don't use the filter, let's assume you want to track where NMS is currently delivering to. As of today, we have delivered to Mbara Health Center 4s. We have delivered to Chotera Health Center 4s, Kalungu Health Center 4s in PG. So that way you're pushing to track whatever NMS is doing in terms of deliveries. Sironko, Budaka, different zones. So we have 4 zones that we deliver to: Zone 1, Zone 2, Zone 3, and Zone 4. So different regions have different districts under a specific zone. Then when we come to the LMD deliveries, that's from the district to the lower facilities, we're in position to know that now let's just give an example. As of today, we have delivered to Mukono district, and the health center 2 is this. Then Mukono district Seta Nazigwe Health Center 2. Then we're also doing last mile delivery in Wakiso. This is Matuga Health Center 3. Let's assume you want to search a facility. Let's just give an example of Mubusu Health Center 3 in Kabarole. You go to search. So we're in position to see that we last delivered to Mugusu Health Center 3. That was in July. That was on July 9th. Here it will show that. Then let's just give an example of Mpungu Health Center 3, Health Center 4 in Kanungu. We're in position to tell that we have deliveries from June, we have deliveries from March. So that's the importance of these filters. Rather than scrolling through everything, you can be in position to just filter out the information you want, whether financial, whether nature of supply, so that way you're in position to easily access the information you want. Rather than going from one tab to another, it could delay. So we're in position to adjust the interface in such a way that the general public can be in position to access this information, and not just accessing it, but accessing it in a simpler way through use of these filters. So I think this is a way of demonstrating how the DMT or the delivery monitoring tool can be used by the general public. Thank you so much.
There is something that I've just thought about. You were talking about DMT and how it's accessed. Can anyone access that DMT even what about those people in the villages with no internet? Are they able to access DMT?
Okay, thank you so much. So just like I've said, there are different stakeholders in this that receive some of these alerts, and we're pretty sure that some of these stakeholders are very influential in different communities.
Yeah.
That's why we talked about RDCs, CAWs, LC5s, DHOs. So those same people can be in position to spread the information to other people within the community.
So you mean someone, I'm looking at my grandmother in Kanungu who has no internet. But maybe there is a sick person at home. They wanted to know whether Kambuga has medicines. But with the use of DMT, like you explained, can someone from Kambuga there who has no internet access DMT?
Just like we all know, this is an online thing. So obviously online and internet go hand in hand. But that does not mean that the information stops there. Because just like I've talked about the different influential stakeholders in some of these communities, considering the fact that they get these alerts, and I'm pretty sure they have access to the internet, based on that, they can be positioned to help us spread this information to the different people at so many levels. So it's not a must that the DMT should be the only way of someone getting to know, but at least we try our level best to ensure that the different stakeholders get some of this information, and based on that, I believe the information that they get, they're in position to spread that information to the other people. And based on that, that's how we're in position to get a very good reception, because you find a vehicle reaching a hospital and we're finding very many patients there waiting. That means the information has reached them in some way or the other, whether it's through radio stations, whether it's through community engagements, but they always get that information. And among the tools we're using is the DMT. as well as influencing the different, as well as informing the different influential community leaders, like I've talked about.
That's something good there. I'm looking at how does a regular Ugandan access that information? How do they know that actually NMS has delivered? Like I mentioned earlier, how does someone from Kambuga get to know that actually NMS has delivered those medicines?
Okay, thank you so much. So, one thing that you need to know is the delivery monitoring tool gives us real-time sight of every consignment from the NMS premises to the final destination, whether it's a national referral, regional referral, general hospital, or lower health centers. So it giving us a real-time sight of the consignment all throughout the supply chain. Someone can be able to track it through the public portal I've talked about for DMT. That's dmt.nms.go.ug. And you can be able to access the different tabs, whether if you want to know what has been dispatched from NMS, you can get to know that. Whether you want to know what has been delivered by NMS, you can get to know that. Whether you want to know what has been delivered to the last mile, there's a difference between delivered by NMS and last mile delivery. Last mile delivery by NMS is basically to we call it trunking. So it's basically to either national referral, regional referral, general hospital, or to the districts. Then last mile delivery comes in from the districts to the lower health centers. The health center 2s and 3s as well as the 4s. Yes. So basically,
so what you're telling me is that there is a difference between essential medicines delivered at the DHO or the health facility, general hospital, or there is what is the difference there?
Okay.
Because you seem in your submission, you seem to tell us that there is a difference between last mile products and those that are delivered to general hospitals and referral hospitals.
Yeah, there's actually a difference. So we basically have direct deliveries as well as last mile delivery. So direct deliveries, what do I mean? The NMS truck lives here with the NMS staff, the delivery clerk and the driver. They go to, let me just give where we do direct deliveries. Basically, we do direct deliveries to national referrals, regional referrals, general hospitals, and currently we're also doing direct deliveries to health center for us. So our team lives here with the vehicle, paperwork, the staff, delivery clerk, and the driver. They reach, let's give an example of Fort Portal Regional Referral. You reach Fort Portal Regional Referral, you put the consignment in the verification area on a tabling in the clean area, organize the medicines according to order numbers. You start verifying based on the invoice. You open the cartons that need to be opened. Then there are those supplier cartons that you don't open because they are still straight from the supplier. So the assumption is the quantities are intact. So based on that, you're doing a direct delivery with someone who is verifying. So upon verifying everything,
the direct deliveries are done at national referrals and general hospitals,
as well as referrals.
That's what you
do. Exactly.
Then what are those that are delivered to last mile?
Okay. So last mile delivery, just like I've said, is basically for health center 2s and 3s. So our truck lives here with the staff. They reach the district. Let's just give an example of Kabarole DHO. From NMS, our team goes to Kabarole DHO with all the invoices for all the different health facilities in the Kabarole, which are averagely like 38 facilities. Then after reaching the district, every district in the country has an NMS container with a slab as well as well-roofed. So that is where National Medical Stores provisionally keeps the medicine prior to last mile delivery, because we cannot use our vehicles are quite big that they may not handle all those feeder roads. So for last mile delivery, we always outsource a 3PL to help us access different facilities. Because some of these facilities you can't even access them through walking. It's that bad. So you either have to use water transport for those island districts, Buvumas, Kalangala, Namaingo, and a couple of others. Then others you have to use borders because the terrain could be quite a mess. Then in some places you have to use the 3PL trucks, which are quite sizable.
Please, you're telling us in languages now. For me, someone who does not know 3PLs, what is 3PLs now?
3PL is basically third-party logistics. So it's an outsourced logistics provider that helps us with the last mile delivery from the district to the lower facilities.
I've gotten lost there.
Sorry about that. Sorry about that.
Okay, you can continue.
Yeah.
Yes,
so all these places during last mile delivery, we access these facilities through water, through having people carry boxes on their heads, depending when they're tearing, through using motorcycles, also through using the 3PL trucks that we outsource, which are averagely 5 to 10 tons. That way we can push into access those feeder roads.
So here we were talking about DMT, and we've learned that it's a delivery monitoring tool, and it's really doing something good. Thank you, Sam, for the demonstration. It was really helpful. Before we close this show, I would like you to give some few closing remarks to the people looking or viewing this show.
Thank you so much. So the DMT is a part of NMS's commitment to a secure, transparent, and efficient medical supply chain for every Ugandan. So we need to take note that the DMT helps us to have real-time sight of every consignment from NMS to the different destinations, like I talked about, the national referrals, regional referrals, general hospitals, as well as the lower facilities. So the general public, just like I talked about, can be able to access this information of NMS dispatches and deliveries through the DMT public portal of dmt.nms.go.ug. That way you can be able to access all the information regarding what we have dispatched to the different destinations, what we have delivered, and the progress of last mile delivery. Thank you so much.
Thank you so much, Sam. It's been a pleasure. Please, when we call you next time, please don't hesitate.
Thank you so much.
It has been a pleasure. To our viewers, thank you so much for following us on this show, and please don't forget to also follow us on our NMS podcast. Bye-bye.
The enablers for us to deliver on time and in full start with us making a social contract with the people that we serve. You realize that the process is to ensure that everything that was handed over to the distribution team is delivered to the customer in full and on time.